This is Bobby Burrows, and I will be presenting on the prevalence of Alzheimer's disease in older adults. Most of us have known older individuals who have trouble remembering things. For most older adults, it is an expected part of aging. However, Alzheimer's disease is not part of the normal aging process, but rather a disease that affects the brain structure, causing a significant decline in memory and physical function. It is important to note that Alzheimer's leads to dementia, but not all dementia is Alzheimer's disease. Dementia indicates that activities of daily life are affected by a decrease in cognitive function. Alzheimer's disease causes the destruction of brain cells through abnormal plaques and tangles, ultimately affecting memory and daily functioning to the point of death. In the United States, there are more than 5.3 million people suffering from Alzheimer's disease. It is the sixth leading cause of death in the U.S., and currently there is no cure or treatment to stop its progression. An autopsy following death is the only way to verify Alzheimer's disease. However, with appropriate testing by a knowledgeable professional, 90% of cases can be correctly diagnosed. Testing typically includes a medical history, testing of mental status, physical and neurological exams, blood tests, and brain scans. Warning signs of the disease include memory loss and a decline in reasoning skills, although physical changes in the brain may have started 10 to 15 years earlier. It is interesting to note that more than half of the people with Alzheimer's and their caregivers state that they were never given a diagnosis of the disease. Providers may avoid giving the diagnosis since there are no definitive tests that would make them 100% sure. This slide shows the devastating physical changes to the brain affected by Alzheimer's disease. The brain on the right is representative of advanced disease. More than 5.3 million Americans have Alzheimer's disease today, and that number is increasing. 96% of those afflicted are 65 and older, affecting 1 in 9 individuals in this age group. By the time you reach 90, your chance of having Alzheimer's is 50%. By 2025, it is estimated that more than 7 million people will suffer from the disease if research does not find a cure. Alzheimer's disease falls into two categories. The genetic version is typically referred to as early onset and means if you have the deterministic gene, you will definitely get the disease. Symptoms of this type typically start in the 40s and 50s. The genetic version makes up less than 5% of all cases, though. The sporadic version is what typically affects older adults, and researchers believe the determinants are a complex interaction of genetic, environmental, and lifestyle components. The determinants discussed will be for the sporadic type of Alzheimer's disease. Age is the number one risk factor as evidenced by the statistics mentioned earlier. As age increases, the risk factors for Alzheimer's goes up exponentially until individuals have a 1 in 2 chance of getting the disease at age 85 to 90. The physical changes to the brain cells cause progressive declines that lead to impaired memory, personality changes, abnormal behavior, and language difficulties. Researchers do not fully understand why the elderly are at such a significant risk for Alzheimer's and state that this is not a normal part of aging. Head injuries have been linked to Alzheimer's disease, particularly when an individual loses consciousness or has repeated trauma to the head. Loss of consciousness appears to be more of a risk factor for males, but researchers believe it is because this gender is more likely to experience these types of injuries. Metabolic disorders have been linked to the risk of Alzheimer's. High cholesterol, type 2 diabetes, and other issues with the metabolism may lead to increased risk. Because these medical issues have a genetic component, we can see how risk genes play into the development of Alzheimer's disease. This is why researchers state there is a genetic component for the sporadic incidence of Alzheimer's. Vascular issues also increase the odds of Alzheimer's. Cardiovascular disease, high blood pressure, stroke, smoking, increased cholesterol, diabetes are all vascular problems that add to the risk. Additionally, research from a recent study indicated that multiple vascular issues create an aggregate risk for Alzheimer's. Much research has also centered around toxic metals and their link to Alzheimer's disease. During the 1960s and 70s, aluminum was believed to be a major risk factor. The Alzheimer's Association states that most researchers now conclude that aluminum from the use of cookware, cans, and other products do not pose a significant risk. However, a 2001 study cited evidence that the elderly had 20 times more aluminum built up in their brains than middle-aged individuals. Most recent studies have focused on the absorption of inorganic copper, including a 2012 paper published by Brewer. The study proposes that Alzheimer's is a relatively new disease that was first indicated in the 20th century. Brewer believes that the copper piping used in plumbing is a cause for the tremendous increase in the prevalence of Alzheimer's. Brewer also notes that underdeveloped countries, which would not utilize inorganic copper, do not have the same prevalence of this disease. It is widely agreed that inflammation creates risk factors for Alzheimer's disease. New therapies have recently been tried using non-steroidal anti-inflammatory therapy as well as omega-3 fatty acids to reduce inflammation. Infections that lead to inflammation are also viewed as potential risk factors. These include periodontal disease, herpes simplex, and other systemic infections. Sleep apnea can also lead to inflammation and cellular stress, which can then affect cognitive behavior and cell interactions. Some studies indicate a bidirectional implication of sleep apnea and Alzheimer's disease. Researchers continue to look for causes and cures for this insidious disease. Other risk factors mentioned include female gender, low educational level, lack of mental stimulation, alcoholism, history of migraines, and depression. Clearly, there are many risk factors and implications to consider when regarding Alzheimer's disease. As discussed, aging is by far the greatest risk factor for sporadic Alzheimer's disease. However, there are clearly many other components causing a complex web of causation. Some factors, such as lifestyle choices, are manageable, while other genetic indicators may not be. As mentioned, aging increases risk exponentially after age 65. Female gender also adds to the risk of sporadic Alzheimer's. Health issues include vascular problems, metabolic issues, and lifestyle choices. Vascular problems include cardiovascular disease, high blood pressure, and stroke. Metabolic indicators include increased homocysteine levels, vitamin D insufficiency, and vitamin B12 deficiency. Note that type 2 diabetes and high cholesterol fall into both the vascular and metabolic categories. Lifestyle choices that can be somewhat controlled include low education level, lack of mental stimulation, alcoholism, and smoking. Additionally, history of migraines and depression add to the health risk factors. External causes include head injuries and exposure to toxic metals, such as aluminum and inorganic copper. Inflammation in the brain can result from decreased omega-3 fatty acids as well as sleep apnea. Infections such as herpes simplex, periodontal disease, and other systemic infections also create additional risk factors. Research continues on these and other topics as scientists try to narrow down the causes of these significant brain changes. Many individuals with Alzheimer's disease will end up in skilled nursing facilities due to their inability to care for themselves. Bonifs explains that the greatest number of individuals in these facilities are high acuity patients, such as those with Alzheimer's. With the anticipated increase in Alzheimer's patients in the coming years, this need will be even greater. There are currently more elder individuals with mental health issues, such as Alzheimer's, in nursing facilities than in state psychiatric institutions. However, 80% of these individuals do not receive treatment from a licensed mental health professional due to funding issues. In many cases, social workers are asked to deal with the patient's mental health needs. Bonifs conducted a study to determine how prepared social workers are in dealing with the psychosocial needs of patients in nursing facilities and found there is a significant need for further education. For example, more than half of the social work professionals involved in the study incorrectly answered specific questions regarding the characteristics of patients with dementia and Alzheimer's. The study concludes that it is imperative that social work degrees and continuing education courses include information on the cognitive and behavioral issues associated with dementia. The study also mentions that many social work students view dealing with the elderly as a negative experience, particularly those who are incapacitated. Bonifs recommends that students and licensed professionals become better prepared to work with this growing population. The Alzheimer's Association offers programs with local community chapters as well as on a national and worldwide basis. The organization seeks to offer support and education to those affected by Alzheimer's as well as their caregivers. The targeted goals of the Alzheimer's Association are to eliminate the disease, to provide care and support to those affected, to promote brain health, and to reduce the risk of dementia. Components of the program include local chapters for each community, a telephone hotline that operates 24/7, offering support to more than 300,000 people per year. When I phoned to get information, I was able to speak with an educated representative, but as I asked more questions, they were able to transfer me to one of their licensed counselors. They also offer face-to-face support groups and educational sessions at a community level. There are comprehensive online resources and informational message boards. The organization also offers Trial Match, which helps individuals find available clinical studies. Alzheimer's Navigator is an online tool for creating individual assessments and needs plans. There are safety services that provide location for individuals with Alzheimer's who wander. For transparency, the association is evaluated by an independent organization that vets charitable organizations. They report that 78% of funds go towards Alzheimer's care, support, research, awareness, and advocacy. Additionally, 16% goes towards fundraising and 6% for administration. In conclusion, Alzheimer's disease currently affects over 5 million Americans over the age of 65. With that number expected to grow by 40% by 2025. Research continues, but there is currently no cure or treatment to slow the progression of this disease. There are many risk factors for sporadic Alzheimer's disease, with the greatest risk being attributed to aging. Social workers need to be educated regarding dementia and Alzheimer's, as they may be the only mental health resource available to patients in skilled nursing facilities. The Alzheimer's Association provides many resources, including education, services, and a vision of eliminating this deadly disease in the future.